Welcome to Dr. Balaga's God Knowledge Doc podcast, your quick dive into the latest medical breakthroughs to keep you ahead of the curve. Let's get started. Today is November 11, 2025. This video is on a JAMA article published on November 9, 2025, 2 days ago, titled Caffeinated Coffee Consumption or Abstinence to Reduce Atrial Fibrillation, the DECAF Randomized Clinical Trial. AFib or atrial fibrillation is common. Coffee traditionally is considered proarrhythmic. This trial tested caffeinated coffee versus abstinence. Sample size 200 adults with persistent atrial fibrillation post cardioversion. They were randomized 1:1. 6-month follow-up. Mean age 69, 71% were male. The primary endpoint was recurrent atrial fib of atrial flutter greater than 30 seconds. Statistics utilized Cox model adjusted by site. What did they find? Recurrence was 47% in those who drank coffee versus 64% in those who did not. Hazard ratio 0.61, p-value 0.01. No major adverse event differences. Limitations: open label, modest sample size, variable atrial fibrillation detection methods. Key takeaways: daily caffeinated coffee may reduce atrial fibrillation recurrence compared with abstinence. The accompanying summary in JAMA says persistent AFib after cardioversion is well known. Coffee's proarrhythmic role is uncertain. 200 adults were randomized to daily caffeinated coffee versus abstinence for 6 months. The results: recurrence 47% versus 64%, hazard ratio 0.61, p-value equals 0.01, no major safety differences. Key takeaway: daily caffeinated coffee may lower recurrence of atrial fibrillation or flutter. Clinical pearls: coffee's perceived proarrhythmic effect is not supported by randomized data. Caffeine's adenosine antagonism may reduce atrial fibrillation triggers. Lifestyle changes, example physical activity, may mediate benefit. Benefits with caffeine were observed at a typical intake of about 1 cup of coffee a day. If you enjoyed this episode, share it with your colleagues. When we change how we see disease, we change how we shape lives. Until next time, stay curious, stay compassionate, and keep seeking wisdom. Podcast brought to you by masterbedfacts.com. This podcast is for physicians and healthcare providers. If you enjoyed this video, please like, subscribe, and forward to your friends.